Disadvantages of perioperative heparin bridging. A. Risk of thromboembolism due to subtherapeutic dose. B. More prolonged total hospital stays. C. Cost and inconvenience of heparin therapy. D. All of the above. Correct answer D. All of the above. In addition to this, there can be excessive bleeding during reinitiation of warfarin with heparin overlap. Hence, continuing warfarin through the procedure is becoming standard of care in certain special instances. This is more applicable to procedures with relatively low bleeding risk and in those with high risk of thromboembolism. Cataract surgery under topical anesthesia is one such potential situation in which the bleeding risk is very low. Ablation of atrial fibrillation is a situation in which the thrombotic risk is high. Which of the following should not be combined with statin? A. Fenofibrate, B. Ezetimibe, C. Gemfibrozil, D. Aspirin. Correct answer C. Gemfibrozil. If gemfibrozil is combined with statin, there is increased risk of muscle symptoms and rhabdomyolysis. In valvar pulmonary stenosis, A. Main pulmonary artery alone is dilated. B. Main pulmonary artery and left pulmonary artery are dilated. C. Main pulmonary artery and right pulmonary artery are dilated. D. Main pulmonary artery, right pulmonary artery and left pulmonary artery are dilated. Correct answer B. Main pulmonary artery and left pulmonary artery are dilated. In valvar pulmonary stenosis, the main pulmonary artery is dilated due to the eddy currents produced by the high velocity jet of pulmonary stenosis. As the left pulmonary artery is in the same direction as the jet, it is also dilated. The right pulmonary artery is not dilated as the direction of the artery is almost perpendicular to that of the high velocity jet. Main pulmonary artery and both pulmonary arteries are dilated in pulmonary hypertension. Conditions which predispose to statin adverse effects. A. Impaired renal or hepatic function. B. History of previous statin intolerance or muscle disorders. C. Unexplained elevation of SGPT. D. All of the above. Correct answer D. All of the above. In addition to these, age above 75 years, Asian ancestry, and previous hemorrhagic stroke are potential conditions to be considered while considering high intensity statin therapy with regard to predisposition for adverse effects. Concomitant usage of drugs likely to affect statin metabolism should also be considered. Effect of sacubitril/valsartan on natriuretic peptides is A. Decrease in BNP and anti-proBNP. B. Increase in BNP and anti-proBNP. C. Increase in BNP and decrease in anti-proBNP. D. Decrease in BNP and increase in anti-proBNP. Correct answer C. Increase in BNP and decrease in anti-proBNP. Both BNP and anti-proBNP are natriuretic peptides which are increased in heart failure. Angiotensin receptor neprilysin inhibitor sacubitril/valsartan improves heart failure and thereby decreases anti-proBNP levels. But by way of neprilysin inhibition, degradation of BNP is reduced and BNP level tends to rise. Which of the following is not a cause of elevated LDL cholesterol? A. Pregnancy. B. Hyperthyroidism. C. Uncontrolled diabetes mellitus. D. Obesity. Correct answer B. Hyperthyroidism. Hypothyroidism is associated with elevated LDL cholesterol and triglycerides. Cholesterol and triglycerides rise progressively throughout pregnancy. It may be noted that treatment with statins, niacin, and ezetimibe are contraindicated in pregnancy and lactation. Triglycerides are elevated in poorly controlled diabetes mellitus. Both triglycerides and cholesterol are elevated in obesity. Which of the following is not meant for closure of patent ductus arteriosus in a newborn baby? A. Paracetamol. B. Prostaglandin E1. C. Ibuprofen. D. Indomethacin. Correct answer B. Prostaglandin E1. Prostaglandin E1 is used for maintaining ductal patency in ductus-dependent circulations. Both oral and intravenous paracetamol have been used for pharmacological closure of patent ductus arteriosus in newborn. Indomethacin was the earlier drug being used for pharmacological ductal closure, but seldom used now because of its adverse effect. Then came ibuprofen, which is still being used. Paracetamol is the latest addition with a better side effect profile than ibuprofen. Here are the relevant references. Which of the following is not used for provocative testing for Brugada syndrome? A. Ajmelin, B. Isoprene, C. Flecainide, D. Procainamide. Correct answer B. Isoprene. ST elevation in Brugada syndrome is quite variable and may need drug challenge for unmasking. Isoprene is not used for provocative testing in Brugada syndrome, though it is often used in other conditions for induction of arrhythmia in the electrophysiology lab. In fact, isoprene is sometimes used to suppress arrhythmia in Brugada syndrome. All of the following are features of Timothy syndrome except A. CACNA1C mutation, B. Named after Catherine W. Timothy, C. Phase 1 of action potential is affected by gene mutation, D. Multi-system disorder. Correct answer C. Phase 1 of action potential is affected by gene mutation. Cav 1.2 calcium channel is affected by CACNA1C mutation in Timothy syndrome. This channel is important in the phase 2 plateau phase of cardiac action potential. Timothy syndrome is characterized by marked prolongation of QT interval, syndactyly, congenital heart disease, cognitive abnormalities, and intermittent hypoglycemia. It is designated as LQT8. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.